after about a week of Arctic conditions, we're all a little stir crazy right now. And Dr. Jana Robinson treats many older adults right here in Memphis, and she's live with us this morning to discuss how to keep senior adults safe in these extremely cold temperatures. Thanks for joining us, Dr. Robinson.
Yes, thank you for having me.
Okay, so you have the 4 C's that you're going to tell us about. Can you explain what they are?
Yes, the 4 C's are cover up, check your furnace or your heat source, count your medication, and call for help. So cover up, we mean dress warmly, choose multiple layers, choose fabrics that wick away moisture, avoiding things like 100% cotton because that holds moisture to your skin are really important. Things like synthetic fabrics and wool are better. You want to do this to help prevent hypothermia or low body temperature, which is a medical emergency. So check your furnace or your heat source. You want to make sure your heat source is functioning properly. Poorly functioning furnaces can leak carbon monoxide into the air, which can be dangerous. You want to make sure if you're using an alternate heat source like a fireplace or a wood burning stove, that's functioning properly as well. You want to count your medication. You want to make sure that you have at least a week's supply when we have these kind of crazy weather conditions like we don't typically have here in Memphis. You want to make sure you have that on hand because going even a few days without blood pressure medicine or medicine for blood sugar like insulin can be pretty dangerous.
Okay, and talk to me about the mental part of this. This is something that has become much more prevalent in recent years after the pandemic, and so now we're really paying attention to this. It's you know, seniors don't get out as much as they used to, and then with this, it's a whole other level. Can you just discuss that?
Yeah, it's a whole different level of being confined in your home and really being unable to leave because of the conditions outside. So doing things where you get up and you move around, even if that's just kind of walking a path inside your home and being physically active are really, really important. Making sure that you still have social connections with people. So phone calls and FaceTime from family and friends is a really good idea. That 4th C is call for help. So make sure you do have a list of those phone numbers handy and make sure your cell phone is charged in case you lose power for that. But getting up and being physically active, even in your home, is a great way to support your mental health during the times that you can't leave your home.
That's right. So let's touch a little bit more on that, the whole physical aspect of it. So is it just like taking a little walk around your living room, or what?
Yeah,
I mean,
it can be something as simple as walking around during the commercials when you're watching a program like this.
Yes.
And just being physically active, even walking in place. I actually talk to my patients about this on a regular basis. I have patients who hula hoop while they watch TV. So any type of body movement is really important.
Okay, and so as far as anything else that you'd like to add, just to close this out, just give people a couple of words of what to do. You know, there are caregivers, and then there are the people who are being cared for. Yeah,
so remember that older adults have increased risk of having things like hypothermia. As we get older, human beings don't regulate our internal temperature as well. So if you're a caregiver or you have older loved ones, please check on them, make sure they're staying warm, make sure they're layered. We also know that cold weather does decrease our ability to fight certain infections. So making sure we're also using those good hygiene practices that we learned during the pandemic, frequent hand washing, things like that, covering our nose and mouth when we sneeze or cough, and also making sure that if you aren't in a warm place, make sure you have one. When our centers are open, we do have community rooms that are open to our patients in the community where different activities happen. We have exercise classes and crafting and different things like that. I believe at one of our centers next week is a fitness week. So different things happening in here.
And we've had your website up. I went to it, and you have lots of different resources there. So we know, of course, where we can go to get more information. We really appreciate you joining us on short notice because, you know, the storm happened. We were like, you know, we need you. So thank you for joining us this morning in between all the work that you do.
Absolutely, and thank you for letting me Zoom so I didn't have to get out on the roads today.
I'm here with you. Okay, thank you so much, Dr. Jana Robinson with Oak Street Health. We appreciate your time.